clone. So if we go against the nature, you know, it will not be theoretically, it will not be good.
All these medicines with
No two people in the world they are similar by DNA fingerprinting of each and every individual. That's how the concept of DNA fingerprinting, thumbprinting is there. So we cannot disturb this balance of creating two similar people and then creating difficulty in criminal investigation and so many other investigations.
No, he wants to do it for that.
No, has it been discussed?
There was an American movie in which Schwarzenegger was cloned.
Yes.
And his clone, once he was cloned, he went into his family and he tries to kill the original Schwarzenegger.
Right.
So this is the thing, but I think full human cloning is still not possible. But yes, cloning for particular organs, like making a heart, making cartilage, should be done, and these can be used as a part as we use in.
At least that should be.
Sir,
Now,
sir, no, he has touched it right. Human cloning technically is possible. But morally and ethically, there are two things, moral and ethical. One applies to the doctors, one applies to the society. Moral and ethical considerations do not permit allowing cloning to be done. Because without cloning, we have so much of discrimination, we have so much of problems. And we have also heard of the times when they wanted to do the cleansing, you know, ethnic cleansing has been done so many times. So morally, ethically, nowhere is it allowed. But what is allowed, and that is, I try to refer to it in some of my slides, is what Dr. Sandeep has rightly called it, and it is called regenerative medicine. Which means once you have cloned or made that cell which is most potent, ask it to grow into one direction. So today, if I need a skin, I can ask my skin to be made into a clone only for the skin. It's available in the market. I can have my cartilage put into my knee joint because it's available. We are trying to see whether you can clone the pancreas, like what Dr. Goswami was saying. You clone the pancreas, it belongs to the same DNA as a human being, it will not be rejected, and it will produce the insulin. In fact, there is a tendency to clone the heart also, and kidneys have already been cloned. So we clone these ones, we don't call it cloning, because cloning refers to a whole organism. This is called making of the different organs, which is called regenerative medicine.
that is being done already.
That's being done. There is a lot of stress on it. That's one of the areas. Sir, before you before you put your next one, medicines are getting costly.
Yes.
Recently, we had the news also.
Very
Government tried to bring down the cost of the medicine. Not only cancer, even the other medicines. They try to curtail the medicine, that if one medicine is low price, then you cannot tag another medicine to it, combination, and sell it expensive. All of them should be low, and they have disappeared from the market for the past few days. Too many investigations, too many tests. Now, there is a ad that I hear every day. It says, why did you, it's Sunday, why don't we go to the lab, we have to get a preventive health check done. 60 test preventive health check done. I'm not sure what are those 60 tests.
I think one thing is very clear for preventive tests that are being done. Only 3 diseases can be prevented by and reduce mortality by screening, and that is cervical cancer in women, breast cancer in women, and oral cancer in men and women. More study has emerged that screening of breast cancer is also not useful. It is only screening of the risk factors which is useful. You may screen for diabetes, you may screen for blood pressure, you may screen for cholesterol once. Anyone who attains the age of 40, do all these tests once, and then that's only for the risk factors, and then try to maintain a healthy lifestyle of correct weight, correct exercise, correct salt intake, correct fat intake, correct food intake, and that is what is important. If you think that you do an angiogram or do a CT angiogram to look at the arteries of the heart and then prevent disease, that is incorrect. It has not shown to prevent disease or prevent heart attacks.
So, I think these ads that we hear and see, they should be legally banned. Because they are not only misleading, but they are directing the public to go in for something which is not correct.
That is probably harmful in the long run.
Sir,
I'll make your job simpler, sir. I'm an architect, I'm just repeating. You were asked a question, why not mix up those medicines? Any building has harmony, consistency, character inside and outside. I remember a qualified person, senior to me, civil engineer from IIT. He had become an entrepreneur. He wanted a building designed at Noida with 4 different elevations. I just laughed at it. I couldn't say anything to him. And he made that building, I must say, it's a failure. Okay? So, a building has, you choose your character. Somehow, now this place we love because outside, inside. And not only that, inside also the character must continue. That is what is important. So the same thing goes for harmony, same for a person and dress and everything. Thank you.
Thank you so much. Yes, sir.
Supplementing and even adding to something that I have said, all people are different, not only because of their DNA, because of their lifestyle. So every patient has to be viewed differently by the doctor in terms of his or her lifestyle, based on which a medical or a diet prescription can be given. Without that, the faith factor doesn't come, if I may say. So I still stick back to the faith factor. I remember my brother used to say, he has not even put the stethoscope, he has not even done this. How can his medicine be good because he has not even talked to me properly and fully? Probably our doctors are too overloaded with the number of patients they have to see in the 2.5 hours that they spend in the clinic. And this is one of the reasons which is perhaps adding to the misery of the patients, running with too many medications and not getting cured. Perhaps it can be curtailed if we have more doctors or more time given per patient.
Mr.
Thank you. I think let's give ladies some chance, please.
We have seen dispensaries with 6 patients coming in a day and more than 6 doctors sitting idle. So that situation is
I'm
also
Rani
very
Gattani, I'm a housewife. So,
What's your good name?
I'm Rani Gattani,
Okay, yeah.
wife of a doctor.
Yeah.
So,
That's more than a doctor.
Doctor's doctor.
So
You're a doctor's doctor.
so I have only one, what I have observed, that our medicine is more dependent on the Western world. And the researches and everything goes on over there. And we trust them and we begin and we start treating them. Like these people were telling that why can't we trust on homeopathic, why can't we trust, because there are no researches done on these. And that is the reason of your not having faith. And we actually, you are also right, how can we prescribe somebody if you don't know what will be the results of it?